Dr. Tom Patterson. I've been in pediatrics in Idaho for 17 years, and I have become a vaccine advocate in the state and enjoy this area of medicine. HPV is a vaccine that we have a great ability to make an impact with our patient lives, and I think that it's important as we've gained more experience that we pay attention to that experience and realize that physicians can make a difference. Changing our approach can change the way patients accept the vaccine. There's good data that shows doctors are not talking to their patients and their patients' parents about HPV vaccine. This is really a tragedy because if you look at each generation that we don't immunize against HPV, the number of cancers that we'll have 10 years from now is really quite striking.
We recommend starting the HPV series for both boys and girls at age 11. And my approach is to walk into the room and let families know that they are due for 3 adolescent vaccines and to list them all together, not separating out HPV vaccine, not making it sound like it's special or different. And that helps parents know that I'm confident in the vaccine, I don't think of it any differently than any other vaccine, and they also feel confident.
When you separate them, you set yourself up for resistance. When you add them as just commonly together, as the adolescent vaccines, you'll have much better success.
Start by introducing it early. Talk about it at the 9-year and 10-year well checks, and sort of give families a heads up and something to read about or something to look toward so that they know that this is a recommended vaccine starting at that 11-year well check. As a healthcare provider, you will meet a lot of parents who are hesitant to vaccinate their children with HPV vaccine. This is related to news articles and misguided information presented on the internet. It's confusing and they're overwhelmed.
There are many objections, and you've all found many, I'm sure. Some of the most common are the number of vaccines given. I think it's important to point out that there are a number of vaccines that kids have gotten and survived already. I think it's important to point out the safety. We have to also discuss the risks. We can't minimize those.
It's important to be ready to respond to these concerns and acknowledge that it is scary to give their children vaccines that they may not feel comfortable with or that are newer. But the important thing is to reiterate that this vaccine has been studied now for approximately 15 years and has shown excellent safety data, and that none of the severe side effects or reactions that have been reported have actually been linked to HPV vaccination. The most common concern that parents raise about HPV vaccination is that it assumes a child is having sexual intercourse or will soon have sexual intercourse.
I think it's important to know that the vaccine has not been shown in studies to lower the rate of first sexual contact, and also I think it's important for us to talk to our patients about the fact that this protects against certain types of HPV and certainly doesn't protect them against all sexually transmitted diseases.
Our goal is to protect kids and adolescents prior to exposure to infection. That in fact we have no expectation for them to become sexually active in adolescence, and that we're hoping to establish good protection well before they become exposed.
It's really time for us as physicians and other providers who vaccinate children to start treating the HPV vaccine like it is, a cancer prevention intervention.
Interestingly, we still have a lot of medical professionals who are not encouraging and not pushing boys and men to become vaccinated for HPV. But I think it's important that we start to think about the true benefits for men.
Boys are quite vulnerable too. There are cancers that impact them, penile cancer, anal cancer, skin cancers, throat cancers, and some solid tumor cancers are now being related to HPV as well.
Secondly, HPV can prevent the vast majority of genital warts, and this is a huge benefit for most adolescents and young men.
And coverage of both boys and girls will overall increase the protection rate of our young people.
This is such an incredible opportunity to prevent cancer, something that we've never been able to do before. This is a virus that is exceptionally prevalent. It causes an infection that is essentially symptomless, and the vast majority of people will be exposed to this at some point in their lives. And if we can take this opportunity now when kids are young and they have not been exposed to this virus to set up a protection and to prevent cancer, I think that's an incredible opportunity.
Get the kids vaccinated, protect them long term. If we do it now, we can protect them throughout their life. If we wait until they're older to have that discussion, if we think they're too young to have it now, we've missed the boat and we're not going to protect them.